Hi there, welcome to Family Health Matters Show. I'm Dr. John McPhee,
I'm Dr. Craig Hazel.
and we're here to talk to you about Tech Neck Awareness Month. The whole month of October is about bringing attention to this really big problem that we're seeing in our culture. The more technology that comes into play, the more we're spending hunched over, and that has real consequences, not just to your structure, as you'll learn, but actually to the stuff that runs inside your nerve system. And I think the thing that we're really the most concerned about is kids and teens, because this is where we're seeing that their structure's still developing, and yet they're putting themselves in this really stressful position. And maybe you can talk about some of the consequences that come from that.
Yeah, and over the next few weeks, we're going to be dissecting kind of the bigger challenges or the secondary conditions that tech neck is resulting in. So the primary problem is that the spine is now moving out of its normal healthy position into what we would call anterior head syndrome. And anterior head syndrome, as you can well imagine, is the head starts to move forward relative to where it's positionally supposed to be over top of the spine. Now the ramifications of that starts to lead into a myriad of secondary conditions or problems, such as TMJ problems, headaches, neck pain, shoulder pain, radiating pains down into the hands and the fingers. And what we're seeing in teens is that if you look at any bus stop or any children's playground, you'll start to see this very slouched posture with a lack of spinal tone and postural tone. And you're imagining that these kids are in grade 2, 3, 4, 5, and they're starting their early adolescence into this already altered postural state. Ultimately, as they become adults, we're going to start to see those secondary conditions just explode. And as we start to incorporate technology into our world, we need to have safe solutions in order to be able to utilize them without compromising our health. You know, what happens is that as that anterior head syndrome happens, the tech neck as we call it, there's a whole bunch of neurostructural effects or those secondary conditions that start to happen. We can have everything from sensory motor problems, so problems just integrating and living your life through your nervous system, through your five senses, but then you've also got 2 or 3 other senses that we're going to talk about over the next couple of weeks. And the effects of that can lead to problems with anxiety, depression, mental health, and emotional problems. So we're going to look at those problems as well, and we're also going to talk about just simply the straight up biomechanical issues that happen as a result of the head starting to shift forward and the effects that it has on the neurostructural system within the neurospinal system. And last but not least is simply the aesthetics of it. I mean, who wants to have that very slouch rounded posture as we age, because we know that over time that's only going to get worse. And I'm going to ask you right now, like, what is the health status of people when they're in a very slouched forward bent posture? It's not good.
Not good.
So what we see time and time again as doctors of neurostructural correction is that we start to see as people age and their posture starts to falter, there is a direct correlation with their health outcomes and how well their body is expressing health. So in solution to that, what we're going to be doing is talking about what are the essential requirements in order to stave off this tech neck. How do we deal with it? What are some of the postural considerations that we need to have? How do we resolve that with our kids? How do we talk to them about it to make it a serious issue for them? Because the last thing we want to see them do is age prematurely and start to create a whole host of health problems for them down the road.
Yeah, so the whole month of October, we're going to be sharing content that's going to help you to actually address this problem with your kids and for yourself too. So what we ask you to do, and I think this is just a great opportunity to check in with your kids' postures, to take a couple of pictures just for yourself, some pre-pictures before the month starts. One from the front, one from the side. We'll actually share a video specifically on how to set them up. And then we have a exercise program, really simple, takes about 3 minutes, and you'll be able to download that. All you have to do is just comment below, and one of us is going to send you a message with that download. You don't need to do anything else other than that. It takes 3 minutes, a couple times a day, and we'll try to make it as fun as possible so your kids are going to want to get on board.
Yep, exactly. We're not going to spam you. We're not going to send you a bunch of emails. All we want to do is just give you that download exercise. So just comment below, and what we'll do is we'll just send it to you in a private message. You'll have the exercises. You can share those with your children. You can do them yourself when you're at work, when you're pecking away at the keyboard all day. Those are going to be some great simple things that you can do a couple times a day just to work on creating some postural reform.
All right, so we will be back on Thursday morning with the first video of this series. So until then, have a great day.